important to someone who is allergic to peanuts and had an allergic reaction at school.
School nurses are an important part of a healthy school system, but across the country there's a major shortage. Only 3 out of 5 schools have full-time nurses on their staff.
Schools in the Wabash Valley are filling that shortfall as well. News 10's Sarah Lehman is live on Indiana State University's campus. She spoke with nursing students and Vigo County school leaders about the growing issue. It's tonight's top story. Sarah tells us why not enough trained people are filling those roles.
Patrice Rondrell, it's a crisis that could be putting many kids' lives at risk. That's why one nursing major here at Indiana State University in the College of Health and Human Services says she could consider doing it later in life. It's being called a national epidemic.
Often can't afford to employ a school nurse, or if they employ school nurses, those nurses are covering multiple schools.
More and more schools across the country don't have a full-time school nurse. For kids with chronic illnesses or disabilities, having no school nurse could be life-threatening.
We'd like to have more nurses. We would love to have more nurses. That comes at a financial cost, and that's always a consideration in any school corporation.
Elizabeth Oswald is a nursing major at Indiana State. She says not having a school nurse growing up is what spiked her interest in the field.
I didn't have a school nurse. Well, at least she wasn't like a registered nurse. She was someone who put Band-Aids on you. But I didn't have that at my grade school, so it would be interesting to see that side of nursing.
Oswald says she did consider working as a school nurse because she does enjoy working with kids. Instead, though, she's taking a job after graduation in a hospital, but she isn't ruling the option out.
My goal is to sooner or later move out of the hospital into a more community-based setting, but I don't know, I could be pulled somewhere else, but school nursing is something I'm interested in.
Now, specifically at Vigo County, they told me that each school has a trained health assistant. That's basically a person in between a teacher and a registered nurse that has an open line to a nurse if an emergency happens at the school. And each school has that, and more schools in the Wabash Valley are also experiencing this shortage. Reporting live at Indiana State University, I'm Sarah Lehman, News 10. Back to you.
Well, there are no federal laws regulating school nurse staffing, but it's recommended that one registered nurse be in every school. The National Association of School Nurses says 40% of schools across the country do not have a full-time nurse. 25% don't have a nurse at all.